Well, hello everyone. Welcome to this afternoon's Safe World by Design webinar. And today we're going to concentrate on skin safety assessment and how we're looking at how different approaches combining in silico and in vitro give what results they give. And then we'll discuss results from two case studies that we've just recently completed. I'm going to start off and give an introduction and cover the in silico part, and then Nathan will come along and discuss the case studies and the new experimental work. So first, some of you may be familiar with the topic, others not, but I'll give a short introduction on the basic concepts that we're using, AOP and IATA, SaferSkin, and the OECD guidance, and discuss how we're going about looking at different compound examples with regards to the results the in silico approaches give, which will lead into discussing our case studies, the in silico results, and then how we've added evidence from new experiments using the SENS-IS assay. And then probably take us about 20 minutes or so to cover that, and then we can have a discussion. It's a complex topic with a lot of issues, so I hope you'll take some time to put your questions into the question box, and we can have a good discussion at the end. So the reverse outcome pathway for skin sensitization has some main events, including the initiation event, and then the response of keratinocytes and other aspects of the immune system, and the assays are linked to key events, as in the current kind of AOP-based IATA paradigm. And this is also a model for a lot of other AOPs and IATAs under development. So I think our results are interesting for the practical purpose of evaluating skin sensitization, but also the model on how to approach IATAs more broadly as we develop new IATAs. SaferSkin, we've been working on as from the point of view of developing a knowledge infrastructure, organizing curated data, applying different kinds of algorithms, Bayesian networks, regression models, neural networks to that data, building predictive models. And we'll talk a bit about comparing the results of different models in this talk. And when the models are developed, then we deploy them to a software with the goal of them being used in risk assessment. The IATA approach combines different kinds of evidence, which may be from various kinds of in silico approaches, could be calculating a cheminformatics descriptor, for example, or it could be some kind of logic applied to how we evaluate the in vitro data. And we'll talk about some different variations on such IATAs and defined approaches in the talk. We've reproduced quite a lot of literature data working with partners, especially from methods developed in industry over recent years. And we've also been building new models using different kinds of assay data, and that'll be a topic of another talk. In this talk, we'll concentrate primarily on assays that have OECD guidance, and then also some methods that are potential inclusions on extensions to that guidance. SaferSkin is also a collaboration, so the idea is to work closely with partners and customers to develop and improve these models. And we have several partners who can run different assays, so including the OECD assays, GUARD and SENS-IS, and we can, as Edelweiss Connect, we concentrate on the in silico part. Can we assure a common data integrity across the work? Can we build good models and include additional evidence across the collaboration? We've carried out reproducibility exercises, and now this year started the case study approach. Again, again, collaborative, and we've also started an internship program, so up and coming scientists can participate in the different activities, including the case studies. So there are several guidelines for the different assays which are associated to the key events. So a key event, KE is a key event. So there's an initiating event for the interaction with skin proteins, and we have several assays associated with that, and we have an OECD guidance 442C, the second key event D, and the third key event E. So these assays have guidance. The GUARD assay has recently been approved for certain applications, and the SENS-IS assay is not yet an approved, does not yet have an approved OECD guidance. It's under evaluation currently. Even if you follow the guidance, that does not necessarily mean that you have a clear result that will be accepted. So you can also use other complementary information. And the more recent guidance getting into the area of using in silico approaches, the so-called defined approaches, was released last year, the OECD 497. There's a guidance document on this. And basically, in summary, there are two methods covered in the initial guidance. One is the voting algorithm, basically 2 out of 3 assays, a rule for a hazard classification. Is your compound a sensitizer or not? And then there's a second method, which is basically a decision tree, which includes a combination of assay data from the DPRA and HCLAT assays and some in silico calculations, and you then end up with a scoring. And that can support, for example, a classification, whether it's 1A or 1B, moderate or strong, or whether it's not a sensitizer. And the guidance goes into detail how you should go about the different calculations in the different steps to come up with the final result. So in the end, this kind of 497 guidance puts a workflow on using the evidence for your decision, and that may include if you do not have assay data needing to generate new data. So we're also using SaferSkin as a way to run workflows and including different partners. So we have Eurosafe here today. When we want a more clearer result, then the assay can be run at the CRO, and we can bring that into the decision. So this case study approach, this is work by Shahina Parveen, and we presented this in our last SaferSkin OECD webinar, and the recording's available at this link. We'll share, of course, the slides and the recording. So there's more detail there. We'll just do a brief discussion of it here today. But you'll see, there are some compounds like farnesyl and safranal here, where the results are quite clear in terms of sensitization, and also are concordant across both in vitro and silico and in vivo. And we also have the third compound here, where the results have good concordance with regards to being a non-sensitizer. So we do have compound situations where the results are clear, and then you can stop and you can make your decision and finish your report. We also took a look and discussed compounds where the results are not so clear. So we may have, for example, if you look across the line here, most of the in silico models agreeing, and that supports what we're seeing in the other assays and the LLNA animal and human data. But we do have an exception here. So in this regression model for this compound, it flagged it as a non-sensitizer. So when you use different algorithms, it's valuable to make these comparisons and then try to understand why one particular model gave you a contradicting result. And in these other examples here, we also have some contradictions that you can see in the table. The two compounds in the last two rows here are the ones we selected for these case studies we'll talk about today. And you'll see here we have contradictions between the in silico models, including between the two different methods from the 497 guidance. And we had a compound here, the decadionate, where it's just not possible with the current assays and guidance to get a result, mainly because of experimental issues with solubility. So these two compounds we chose out for the SENS-IS assay to see if we could improve our evaluation of these compounds as example case studies. And we'll be writing this work up shortly and sharing it as an open access article with open access data. So you can all take a look at it. So just going through three examples from that table. First of all, starting with the propylamine, you'll see here that we have a borderline case for one of the assays, but two positives. So the voting clearly flags it as a sensitizer. The second OECD method based on the decision tree, the ITS, flags it as a moderate sensitizer. And for the most part, our models are in agreement, except for the regression in this case. Another point here, depending upon whether your application is a hazard assessment or a risk assessment, some methods like the Bayesian network or the regression method allow you to derive from your models based on a larger number of compounds as well, a potency. So they can give values that you can use in risk assessment, whereas other methods like voting cannot. And another thing to take an eye on is do we have mechanistic alerts? It's valuable to look at the metabolite issues. So as an example here, we do find quite a lot of metabolites with protein binding alerts, including one with a sensitization flag. So these are issues you may need to also consider in the compound as well, and look in more detail at a metabolite. Also, you'll see that there's high permeability predicted, which may be important for increased penetration and issues with systemic toxicity. So looking at the skin penetration is also important for the overall risk assessment. Squaric acid, which was one of the compound experimental results on today. When Shahina looked, she didn't find animal, human, or data from the newer assays. If anyone knows of that data, it'd be great to hear, but currently she didn't seem to find any from her work. And we have these results from the in silico approaches where sometimes we're getting it flagged as a moderate sensitizer, sometimes as a non-sensitizer, and we have values derived for the Bayesian and regression method on potency values. So we thought that was a good candidate to look at with the SENS-IS assay, see if we could get a clearer picture. Again, we see there is a protein binding alert. There are metabolites, including protein binding alerts. Unfortunately, no sensitization data was found in the toolbox for the metabolites. Again, high skin permeability, which could be an issue. And the second compound, the decadionate, really with the current OECD assays with guidance and the 497 with the in silico methods, it's just not possible to get a clear result. This compound does have an ECHE dossier where human patch test data was used to support the non-sensitizer result. We didn't have existing data on GARD or SENS-IS, so we thought this was a good candidate for the SENS-IS assay, because one of the problems here is with solubility. It's a lipophilic compound, and one of the advantages of the SENS-IS assay is we could actually run the assay on the compound and see what the results were. So in summary, with current OECD guidance, we could not get a result, not even any result actually. So it's inconclusive, and so hence a good reason for using another experimental method to see if we can get a better result. Again, we're looking at the metabolite profiling is interesting. Again, we find a protein binding alert. We find several metabolites with protein binding alerts, including 8 for Michael addition. So that's some warning there that there may be some initiating events with this compound, and some evidence with one metabolite on sensitization. Again, high skin permeability for many of the metabolites is maybe a factor to consider. Now, with that, I'll hand you over to Nathan, who will describe then the experimental work with these 2 case study compounds. So Nathan, over to you.
Yeah, thank you, Barry. I'll give you my camera, maybe.
I will go away with the camera and let you concentrate while you're talking, and I'll come back and join you at the end.
Okay, thank you, Barry. So here you can see the 2 compounds interesting to test in the SENS-IS assay, the squaric acid and the decadenoate. But just before I give you the results of the experimental part, I'll give you an overview of the SENS-IS assay. Barry can go to next slide, please. Thank you. So what is the SENS-IS assay? Is a pattern protect test, and the aim is to make a distinction between skin sensitizer and non-sensitizer compounds, and it made by analyzing the expression of a panel of gene expression and of gene overexpressed when you have sensitization endpoint. So this test has a really good performance in terms of sensitivity, specificity, and global accuracy. As I said, you can estimate the sensitizing potency and make a discrimination between category 1A and 1B. And the main benefit is its large domain of application. You can test solid or liquid forms, hydrophilic, lipophilic compounds, soluble, non-soluble, partially soluble compounds, ingredients, as well as finished product or medical devices. You have a really, really large domain of application with this test. And if you go to the next slide, just to have an overview of the process here. So the aim of these assays is to assess a panel of gene overexpressed. So we have 3 groups of genes, 2 related to the sensitization endpoint and 1 for the irritation. So we have the error group, 17 genes involved in redox detox mechanism via NRF2. We have the SENS-IS group, 21 genes involved in the inflammatory mechanism, cell migration, T-cell recruitment, and so on. And we have 23 genes involved in the irritation and TC damages. So after simple sample treatment on the reconstructed human epidermis, we do RNA extraction, reverse transcription, and we assess the overexpression of the gene panels. So we have different threshold gene. You can see this, Barry, on the next slide, please. Here, for the prediction model, we have different thresholds for the sensitization of in each panel gene. We have 7 to have positive response in the sensitization endpoint, and for the irritation, the rule is on 16 overexpressed gene to have a positive response. But with this test, we could also do potency prediction, because we test the compound at different concentrations, and these concentrations correspond to different hazards classes. We can do hazard class in a GHS model, 1A and 1B, and as you can see on this slide, we can do some classification according to the LLNA prediction, a weak, moderate, strong, or extreme sensitizer. And the aim of this potency prediction is to find the lowest concentration that cause an overexpression of the genes, of the panel genes, and with this you have your prediction. So if we look on the results we had with the first compound, we can do on the next slide here with the decadienoate. So the issue is about the physical form. We can't test this compound in the traditional assay, in the OECD assay, but it is possible with the SENS-IS test. So here, as you can see, we have two concordant positive response at 1% dilution in the DMSO. So with this results, we can conclude that this compound is a strong sensitizer in category 1A. So this is the first result, and for the second one with the squaric acid, Barry, we can show next slide, please, here. So we have different results, and we found a negative response because we have two concordant negative response when we test this compound as a pure one. So as you can see, we have a non-sense with the SENS-IS test. We can say that this compound is a non-sensitizer. And in the next slide, we can compare the result with the other one we have on the different models. So for the second one, the decadienoate, the only answer we have is by SENS-IS assay, because we can test this one with this assay. It's pretty clear. But for the squaric acid, we have another response. We have difference between the methods. As Barry said, the SENS-IS could not help here, and I think we can take a conservative approach and consider this compound as a weak sensitizer. So Barry, is clear for me?
Okay, I was muted. I come back now. Yeah, so just some conclusions. And silico approaches are a useful first tier in a testing strategy, including an IATA. So you should start with all current available data and models, including different approaches, some of which we talked about today, but also there are also other approaches such as read across. And you may, for your purpose of hazard classification or risk assessment, get a clear and convincing answer, and you can then stop and go ahead with the risk assessment work. However, as we've shown, we may also obtain contradictory results or results with lower confidence, higher uncertainties, or even cases which are not feasible. And I mean, such results are very much dependent upon the case. So on a case-by-case basis, you need to take a careful look at what the current data models are saying, and then have that inform your second tier, where you would look at, could I add additional data to improve my evaluation? Could I add additional data over a set of compounds to build a better model, and so forth? The in silico results can then guide you on what experimental data would be useful. You're not just running the experiment blindly. Case studies in this area of both using and improving IATAs are, I think, a valuable approach. Each case may have its own complexities, differences, and issues, and needs careful analysis. And probably in summary, in the area of moving IATAs forward, we need quite a lot of case study work. In summary, my last point is we do need ongoing collaboration and generation of new data to continue to improve the approaches, and also to improve future guidance.